With more patients being transferred from one hospital to another, the strain on Ontario healthcare is again reaching far beyond those with COVID.
The growing backlog of surgeries and procedures will result in unnecessary suffering and death.
The province is putting off all remaining surgeries considered non-urgent. Patients with procedures postponed taking to social media to say they've been waiting 6 months, 9 months, even 2 years, with now no appointment in sight.
That should give us 1,200 to 1,500 additional beds in which we can care for Ontarians if they need extra oxygen for a short period of time.
In Quebec, new projections suggest an unprecedented 3,400 patients could be hospitalized with COVID within 2 weeks.
It's an invisible war, and right now we feel like we're not winning.
With 20,000 healthcare workers now sick or isolating, the health ministry is warning it may run out of staff. Quebec hospitals are already operating at their highest alert level.
We're in a really critical phase, and you can't keep up a level 4 for a very long period of time without having some side effects from that.
Remote corners of the country are struggling too, like Nain, Labrador, an Inuit community of 1,100 where only a single nurse is left not in isolation. Sky-high absenteeism across the province is forcing the remaining hospital staff to fill the gaps.
It's hard to be able to take staff from one situation and put them in another situation because the need is dire in both.
24 Manitobans have died from COVID since the start of the year. Dozens are in the ICU with more expected. Winnipeg's mayor has a message for those oblivious to the surge.
I hear about people holding parties in their homes, like really just pretending like it's everything is just fine. It angers me to no end.
And Thomas, let's talk about the concerns hospitals have about the situation in the ICUs.
If you look at the average number of patients requiring intensive care because of COVID here in Ontario, right now it's at 252. That's a 40% jump from just a week ago, Ian. And in some hospitals, they're already being overwhelmed. And one health network in particular in southwestern Ontario, they're looking at critical care capacity already full. Every bed is taken. And the CEO of that health network told us today she fears what they're seeing there could be the case in every hospital across Ontario very soon.
All right, Thomas, thank you.
You're welcome.